Today, we're going to talk about a small but mighty gland that secretly runs the show when it comes to your energy, your metabolism, and even your mood. We're talking about the thyroid. We'll break down exactly what it is, what happens when things go a little off-key, and most importantly, how to get back to feeling like yourself again. It helps to think of your body as this incredible, complex orchestra. And the conductor, the one setting the tempo for everything from your energy levels to your heartbeat, well, that's your thyroid. When it's in sync, everything just works. But if that conductor loses its rhythm, the entire system can start to feel chaotic. So here's our game plan. We'll start with who this quiet conductor is. Then we'll get into what happens when that harmony is lost. We'll investigate the causes, look at the diagnostic toolkit doctors use, find the pathways back to balance, and then wrap up with your action plan. All right, let's dive right in and get to know our quiet conductor, the master gland that's really in charge of your body's entire metabolism. Okay, so if you touch the base of your neck right in the front, that's where it lives, this small butterfly-shaped gland called the thyroid. Its main job is to produce two critical hormones, T4 and T3. Think of these as little messengers that travel all over your body, telling your cells how much energy to use. And that simple instruction controls, well, almost everything: your metabolism, heart rate, body temperature, even your mood. Now, the thyroid isn't just a solo act. It's part of this really elegant feedback loop that starts all the way up in your brain. First, the hypothalamus sends a signal to the pituitary gland. The pituitary then releases something called TSH, or thyroid-stimulating hormone. TSH is basically the message that tells your thyroid, hey, time to get to work and make some T4 and T3. And here's the brilliant part. When your hormone levels are just right, they signal back to the pituitary to quiet down. It's this beautiful, self-regulating system. But what happens when that perfect system gets disrupted? Let's move on and see what it looks like when that harmony is lost and explore some of the most common thyroid disorders. So thyroid issues usually fall into two main categories. On one side, you've got hypothyroidism. This is when the orchestra is playing way too slowly. You might feel fatigued, gain weight, always feel cold, and notice your skin and hair are dry. Then, on the flip side, you have hyperthyroidism, where the tempo is just frantic. Everything is too fast. This can show up as anxiety, unexplained weight loss, feeling hot all the time, and a racing heart. So, what are the specific conditions driving these symptoms? Well, the number one cause of an underactive thyroid, or hypothyroidism, is Hashimoto's. That's an autoimmune condition where your own immune system mistakenly attacks your thyroid. For an overactive thyroid, or hyperthyroidism, it's very often Graves' disease, which is another autoimmune issue that basically puts the gland into overdrive. Then you can have physical changes, like little lumps called nodules or a swelling called a goiter. And sometimes temporary issues can pop up, like postpartum thyroiditis after having a baby. You see the common thread here? It's often about the immune system. And that leads us perfectly into our next section, investigating the cause. Why do these things happen in the first place? What are the risk factors? As we just saw, the main driver is often an autoimmune condition, but other things can definitely play a role. For example, getting either way too much or way too little iodine can cause problems. Certain medications, exposure to radiation, and the huge hormonal shifts that happen during and after pregnancy can all be triggers. Smoking is a known risk factor, and of course, having a family history of thyroid issues puts you at higher risk. It's almost never just one thing. So, if you're experiencing symptoms, how do doctors actually figure out what's going on? Let's open up the Diagnostic Toolkit and see how they listen in on the thyroid. And this is so important because a diagnosis isn't just based on how you feel. It really requires a clear, objective look at what your hormones are actually doing. So how exactly do they do that? The whole process nearly always starts with blood tests. That's the foundation. From there, a doctor might want to do a thyroid ultrasound to get a good look at the gland itself, its size, its shape, and to see if there are any nodules. For a deeper dive into function, there's something called a radioactive iodine uptake scan, which shows which parts of the thyroid are working hard. And if a nodule looks suspicious, they can do what's called a fine needle aspiration, which is just a type of biopsy to check the cells. Of all those tests, the TSH blood test is the absolute superstar. Honestly, it's the single most important number for understanding your thyroid's health. Remember that command chain? Well, if your thyroid is sluggish and underactive, your pituitary gland has to yell louder to get its attention. So your TSH level goes way up.
But if your thyroid is overactive and pumping out too much hormone, the pituitary just whispers, and your TSH level drops. It's this simple inverse relationship that gives doctors a powerful first clue.
So, once a diagnosis is confirmed, the goal becomes restoring that beautiful harmony. This brings us to Section 5, Pathways to Balance, where we'll cover treatments, lifestyle, and the real-world realities of managing a thyroid condition.
For an underactive thyroid or hypothyroidism, the gold standard treatment is a medication called levothyroxine. It's simply a replacement for the T4 hormone your thyroid isn't making enough of. For an overactive thyroid, the goal is to gently apply the brakes. That can be done with anti-thyroid drugs, radioactive iodine to shrink the gland, or sometimes surgery. For nodules, most of the time it's just a case of watchful waiting. And while things like good nutrition and stress management are absolutely vital for support, they are partners to medical treatment, not a replacement. And of course, this is always a conversation to have with your doctor.
And that brings us to a really big, hopeful question that a lot of people have. Can you actually reverse these conditions? Well, the answer is it's nuanced. It really depends on what's causing the problem in the first place. For some conditions, like Graves' disease or that temporary postpartum thyroiditis, remission is definitely possible. Treatment can calm everything down and the thyroid can start functioning normally again. But, as this person shares, it's not a one-and-done thing. It requires regular checkups to make sure things stay in balance.
But for chronic autoimmune conditions like Hashimoto's, the goal is a little different. The underlying autoimmune issue doesn't just vanish. So the focus shifts from a cure to successful, lifelong management. I love how this person puts it. They're not cured, but they are managing it. And the most important part, they feel like themselves again. That's a key difference. Remission versus management.
Okay, so armed with all this knowledge, how do you actually move forward? This brings us to our final section, your action plan. This is all about helping you become an effective partner with your doctor. Being an active participant in your own healthcare is just everything. So go into your appointments prepared. Don't just ask what tests you need. Ask why. Ask what your lab results actually mean for you. Talk about all the treatment options, the pros and the cons of each, so you can make a decision together. Understand the long-term plan for monitoring, and always ask if there are lifestyle changes that can support whatever medical treatment you choose. This is how you build a really strong partnership. If you want to keep learning, please stick to trusted sources like the American Thyroid Association or the Endocrine Society. In the end, it really comes down to this. Understanding your body's quiet conductor is truly the very first step toward reclaiming your well-being. It's how you make sure your personal orchestra is playing in beautiful, vibrant harmony.